It makes no business sense to roll out mass testing for the entire Kenyan population. Speaking to TV47 on phone earlier, the Acting Director General for Health in the Ministry of Health, Dr. Patrick Amoth, said that the government sees more sense in engaging in targeting testing owing to the fact that sample collection kits are not sufficient at the moment. The Kenya Medical Practitioner and Dentist Union Acting Secretary General, Dr. Chibanzi Mwachonda, on the other hand, says as much as the capacity to embark on mass testing is not adequate, this status of affairs may enhance the breeding of transmissions, and asymptomatic cases already have been cited to existence or in existence.
On Tuesday, Acting Director General for Medical Services in the Ministry of Health, Dr. Patrick Amoth, confirmed on phone that the government indeed does not have capacity to embark on large-scale testing of the population in terms of sample collection kits. Dr. Amoth stated that sample collection kits are not enough in the country, and this situation may persist as hurdles in the supply chain continue. Currently, the government is purchasing its testing kits from China, the United States and Europe. Medics such as the Kenya Medical Practitioners and Dentist Union Acting Secretary General Dr. Chibanzi Mwachonda concede that the testing kits capacity is low, but this state of affairs may be a breeding ground for transmission of coronavirus, especially bearing in mind the fact that there have been reports of asymptomatic cases of people who are positive but showing no symptoms.
If in the community you have a big number of people who are exhibiting mild symptoms, just like your normal sore throat, your normal fever, just a slight fever, they'll easily transmit it. So the only way to reveal that is if you were able to conduct mass testing.
Acting Director General in the Ministry of Health, Dr. Patrick Amoth, says Kenya is not the only nation experiencing this issue of insufficient testing kits. In fact, the government recently received testing kits from China to help kickstart the mass testing operation, and still there is a deficit towards what could help test on large scale. This state of affairs is being seen by some medics as lagging the country behind the virus.
Currently, we are behind the disease because we are only doing contact tracing. So when we do mass testing of people, then we're going to be slightly ahead of the disease.
As positive cases continue to rise in Africa, the World Health Organization has warned that the continent is not getting accurate figures on the extent of the outbreak due to lack of capabilities to conduct mass testing, indicating that mass testing is vital. However, Kenyans are being urged to observe all preventative measures in place. Leangare for TV47.